Welcome back. It's great to be having this conversation. And today I'm going to do a reflection on SCOMRA conversation that we had, and most importantly, the imperatives of what are the priorities for the new DG as she takes over office and she steers the organization to the next level that we aspire for it to be. So before we get to talk about SCOMRA, we need to understand where does this conversation around African Medicines Agency come from? What was the genesis? What is the foundation of it? 1992, heads of states had a convening in Abuja where we had the Abuja Declaration. Most of the conversation that normally follows that pronouncement is always around financing for healthcare, with a commitment that they made to get to 15% of the national budgets going into healthcare. That has not been achieved in most of our countries, but that is not the conversation for today. The conversation for today is that in 1992, when this Abuja Declaration was being made, HIV/AIDS, TB, and malaria had already been a challenge, and HIV was at the peak of its time, was ravaging the continent. And as heads of state, the governments actually acknowledged that unless there was reliable access to these products that we needed at that particular moment, the antiretrovirals that were available, there was local manufacturing capability, there was going to be a challenge in mitigating the impacts of the harm that were attributed to this COVID-19. And therefore, the first pronouncement to ensure that we build a local manufacturing capability within the continent started at that point in 1992. As much as that happened, not much action took fruit, and therefore there were still kind of pockets of action in action, and there was not actually coordinated agency or institution to lead those efforts to build a local manufacturing capability in the continent. 2005, the heads of state, again in a following conversation and a following convening under the African auspices of the African Union, made a declaration that for us to be able to achieve the aspirations of what had been envisioned in 1992, there was to be a clear business case for this, and there was to be a clear plan on how to achieve it. And that led to the commitment to follow through and develop the Pharmaceutical Manufacturing Plan for Africa, PMPA. When PMPA was finalized, the initial plan and everything, did a lot of work in terms of scoping the markets, understanding the barriers, the challenges. 2009, we had a rollout of the business plan for Pharmaceutical Manufacturing Plan for Africa, that is PMPA. After 2009, one of the key things that were being looked at in terms of drivers and enablers of growth was the regulatory system and regulatory ecosystem in the region. And the essence of the regulatory conversation was, one, we needed to have quality products, we needed to build quality system in our pharmaceutical manufacturing capability, but also there was a realization and an acknowledgement that we were not going to start manufacturing like it's a switch we're turning on. It's not a light bulb switch. It's a matter of taking steps toward that aspirational future that we hope for as a continent. And therefore, we still would need to import products that are coming in from other regions and all that. We needed to have regulatory mechanisms that would guarantee we're getting the right quality products, the right quality solutions into our markets. And that was a key piece around it. And that is why now when we came to 2012, the Africa Medicines Regulatory Harmonization Initiative was formalized and then operationalized with the commitment that we will strengthen the regulatory system as an enabler, as a catalyst for growth of the industry. One, in trying to ensure that the products that are coming into the continent are safe, effective, quality, and reliably supplied. But on the other end, we're building quality system for the local manufacturing industry, for the local ecosystem, so that we can drive growth in the local manufacturing industry. And that has been work that started from 2012 with the regional economic communities. We ultimately had regional centers of excellence in regulatory activities within the different regions. And ultimately, in 2019, 2020, the conversation and the momentum picked up for the African Medicines Agency establishment. 2021, the ratification of the 15th country, Cameroon, took place, and therefore then we had kicked the ball and things were moving towards getting the African Medicines Agency working and operational. From then, we've had progress over time, and we've had more than 29 countries, almost 30 now, who have ratified the treaty. And as we're moving to the next level in this conversation, the agency has an appointed Director General with offices established in Rwanda, Kigali, and therefore the agency is in place. The question is, what next? How do we move to the next level to ensure that the gains that have been achieved over time are sustained and maintained? But most importantly, beyond the gains are actually complementing the initial foundation aspiration of what I've talked about in terms of ensuring reliability and access. And we have to take note that from 1992 to the current moment, there has been a drastic change in different parameters and variables within the ecosystem. You look at it, we were dealing with infectious diseases, especially HIV/AIDS. HIV/AIDS is still a problem, but still not the best problem, the greatest problem at the moment, because we have established reliable access to some of the antiretrovirals, except for some of the ongoing disruptions with the funding dynamics within the global health ecosystem. On the other end, we have a growing burden of non-communicable diseases, including cancers, and therefore we need to ask ourselves, how are we regulating for the quality of these products? How are we building the ecosystems to promote local manufacturing where there's a need for that and there's a capability for that? And if we can take note, if you look at all the Africa Union 3S, there's a pharmacovigilance surveillance system that has been in place. There has been mentions around substandard falsified anti-cancers. Even in terms of our regulatory authorities, there have been issues that are being noted as pain points and challenges that we needed to address and we need to look into. So when you look at those key factors that are coming in, the regulatory agency AMA must have a clear mandate and a clear focus. During the SCOMRA conversation, the DG outlined 3 key priorities. Number 1, if we are going to safeguard and look out for the well-being of the whole continent of Africa, all member states need to ratify the AMA treaty. They need to be members and signatories to the treaty, to the agency that is being operationalized. And therefore, one of our key priorities is to ensure that ratification does happen. What does that mean for us? All of us as different stakeholders in our different walks of life, we have an obligation and a commitment to support that mission. You know, some of the leaders and politicians in your countries, the government agencies, have conversation with them and try to see how can we convince those countries that have not ratified to actually move towards ratifying this treaty, to ensure that all of us are protected and all of us have kind of a clear, robust framework around regulatory harmonization. It's about supporting her to get all member states ratifying the treaty. That's a key piece. Number 2, when you look at the roles and responsibilities in regulatory ecosystem, we have the national regulatory authorities at the country level, because sovereignty lies with the state, and therefore the state has a duty of care for its citizenship and citizenry in that context. So with that said, the national regulatory authorities have to be as robust as possible, have to have the best systems as possible to oversee the products that are getting into the country or that are used in the country that are being made available to patients. On that account, we look at the continent of 55 countries. We only have 9 maturity level 3 countries. Not all of them at the same level across the scope, because some are only for pharmaceuticals that are being imported, some are for vaccines, some are for pharmacovigilance related activities and all that. So there's different variability, including lab capability. So then we have different variability in capabilities, but we need to move all of them in all the functionalities that are critical for each of the countries to probably WHO listed agencies. At the moment, we're talking about 9 ML3. There's still more work to be done. And in her commitment, she talked about how to support national regulatory authorities to strengthen their internal national ecosystem, national regulatory frameworks, and that is an ongoing work. And definitely with the WHO GBT benchmarking assessments that are going, there is work to ensure that we have robust national regulatory authorities and regulatory systems in place. That is a key piece. Number 2, we have the regional economic communities that have been formalized. The first one being the East Africa Medicines Regulatory Harmonization that started in 2012 at the onset of Africa Medicines Regulatory Harmonization. These regional economic communities are models for what AMA should look like and how AMA should operate, and therefore they need to be supported, and it also builds the pockets within the regional economic communities and all that, where the trust has already been built. So the support is to the national regulatory authorities and the regional economic community. Then ultimately AMA having different regulatory functions. There's work to be done in terms of structuring the scope of products that will be in all of them. But most importantly, and this is a recommendation that I would say, the AMA team needs to look into critically and strategically in the next phase of the work that they are doing. And this is about ensuring that the recommendations at the regional level, recommendations at the continental level are reflected as registrations at the country level. Because unless that happens, the access is a key conversation that will never be achieved, because people depend on the products being registered to be in the country. And if the national regulatory authorities are not adopting them, then it's not going to help. And that ultimately means industry might not consider using these alternative regulatory pathways, which we aspire for them to use. And that is what we are hoping for. So that is an engagement, and I would say that capacity building is also about saying, how can we domesticate, how can we operationalize these regulatory recommendations from a regional level, from a continental level to a national approval? Because that national approval, that is what will guarantee, as David in Kenya can get access to a medicine that was recommended through AMA, but it's still now registered by the Pharmacy and Poisons Board in Kenya. That is a key piece that we need to look at. The last piece is all these were working to ensure that we have a robust local pharmaceutical industry, which is strengthening local pharmaceutical manufacturing. And I would say from a continental level, from the work that we do as African Pharmaceutical Network as well, there is an opportunity for us to build talent and to build a talent pipeline. And that is something that we've been doing through the Pharmacy Academy that we are building on. And we think there is value for us to create that pool of talent, which will drive growth in the industry. But beyond that growth in the industry from a talent standpoint, we need to put mechanisms to ensure that the ecosystem is growing together. Quality management system, do we have that? Can we incentivize production of APIs and excipients within the local ecosystem? How will that operate? And I'd say some of the key things that are coming in from the AMA DG is that she's going to commit to driving the local manufacturing agenda and engaging with industry as much as possible to ensure that that becomes a reality. From a Africa CDC perspective and the African Union, there's PIFA, the Partnership on Investment for Pharmaceutical Manufacturing in the continent. And I would say that partnership is a key piece in terms of driving engagement from a financing standpoint. And the financing is coming, means industry must absorb that financing to help it unlock value within the ecosystem. Unfortunately, and this is a key point there where there's work to be done, engaging the private sector has to be a key priority within the next phase and next mandate of AMA. And if that doesn't happen, all these gains will be assumptions and will be wishful thinking in my perspective. Because the industry are the people who will apply for registration, whether it's industry from private sector or industry from these development partners and all that. Industry must be a key player, especially those who are doing research and development, bringing new products into the continent. They have to be engaged and they have to have skin in the game from a prioritization in the sense that sustainability plan, AMA will only work when there's money that is funding it. That money will come from regulatory fee, and the regulatory fee for service will be based on if I submit it and it gets a recommendation at the AMA level, then it will be a registration at the country level within particular predictable timelines that are good for us, that are good for the ecosystem that we aspire for. And I would say those are key conversations that we need to be able to move towards. Build local manufacturing, engage industry as much as possible, strengthen regulatory authorities, and most importantly, AMA being the continental agency at this particular moment should have the capability to start at the best or the topmost level, which means as a regulator, it should be either benchmarked at IMA 4 and above or be a WHO listed agency. How will that happen? Having the right talent, and I would say this is the opportunity for us to build the right talent across the ecosystem and get the best people to do the work that needs to be done at the agency. Having robust regulatory frameworks and quality management system is a key piece for AMA as it starts off. But most importantly, having clear sustainability structures and frameworks that will guarantee that the work of AMA is not dependent on donor funding as much as it's going to be in the initial phase, but having a robust mechanism in the long term, because that is what will ensure that it is reliable, it is dependable in the long term, and that is what we'll be considering it as an ML3, a WHO listed agency rather. So there is work to be done, but this work is not only for the AMA DG and with her team as she starts off, it is also work that we have as stakeholders in the ecosystem, and we need to ensure that we drive that conversation. From our engagements in the industry as African Pharmaceutical Network, we commit to drive the work in terms of capacity building, to drive the advocacy work in terms of strengthening ratification and actually driving conversation around how do we get all the member states to ratify the treaty. And the last piece, which is the core of what we do, working with industry players to build their capability to comply with these regulatory standards and requirements, but most importantly, scale them to the next level and bring the local manufacturing agenda to the fore of our conversation. Local industry must be part of the conversation. If that doesn't happen, then we will be doing a work that does not end up in the ultimate outcomes and expectations of what we have as a continent. And that is not what I think we need to do as a continent. Thank you for the conversation, and in case of anything, do reach out, comments, share with your friends, let's subscribe, let's grow the community as we learn and shape the continent that we aspire for. Thank you and have a good one.